Well, we've already been talking about how the pharmacist is often the first healthcare professional that people see. So the question is, what are the most common types of medications that people ask for? What do you see in your practice?
So in practice, I would say the most common things that people either come in for or inquire about would be, for the general aches and pains. So they might have a headache, they might have muscle pain, they might have joint pain, which is very common now. Some people also, especially on the women's side, menstrual cramps. And then on the prescription end, we may have somebody who comes in with a prescription for something to treat their dental pain. They may have a wisdom tooth that was maybe recently removed, or in some cases where they recently had a surgery where they may be prescribed opioids in that case to help treat some of the breakthrough pain that they're experiencing from the surgery.
So wearing my palliative medicine hat, people continue on opioids through a severe illness. That being said, I work in a clinic called the Multidisciplinary Metastatic Spine Clinic. And this is a clinic where we care for people who have a diagnosis of cancer and who have the cancer has moved to the spine. And we are multidisciplinary. We have a neurosurgeon who can offer surgery if appropriate. We have a neurointerventional radiologist who actually goes in with a needle and puts cement into soft spots or holes in the bone. And we have radiation oncology. So these are just different pain modalities outside of using opioids. And in this clinic, I've seen remarkable reductions in pain after procedure. And actually, we're taking people off of their opioids. And that's often my role. I manage pain before a procedure, and then once their pain is better and their function is improved, I actually slowly taper them off of their opioids. We've had great success.
I remember when I was in the hospital after they took out the epidural and put me on opioids, and I asked, there was a pain doctor there, and I said, am I taking too much of this stuff? And she said, it's more important to control your pain.
So that's one of the biggest worries I see and takes a lot of counseling. And people often wait, especially with cancer-related pain. They wait until their pain is 8 or 9 out of 10 before they go and take a medication. We counsel people that pain is much easier to manage when you're managing it at moderate levels. Once it gets severe, it's much more difficult to manage. So at that 4 or 5 out of 10, that's when we really should be aggressive in bringing people's pain level down.
In all of these discussions, I agree with you. The most component that's missing is patient education. In the circle of care, patient has to be in the center of this circle. Patient has to be in the driver's seat for their care and healing. They need proper information, and for that information, then they can make proper decision about their care. And as physicians and other allied healthcare workers, we have to provide patients with proper education about what they are getting as medication, what will be the effect and side effects and long-term effects of it. And then the patient be an active component in this whole journey instead of being prescribed to them and then that's it.
I think a pharmacist would come in with that. Often, when patients get to see the doctor, they don't remember to ask everything. It's kind of more rushed and stressful than seeing the pharmacist.
Exactly, and that's where we come in, right, into the picture, just to create that circle of care. So make sure before the patient does leave with the medication that they understand what they are taking, what they have been prescribed, and to make sure that they know how to use it and that they are aware of some of the risks that may be involved with using it in terms of when it comes to the side effects. So that's definitely where the pharmacists come into the picture to make sure that before the patient starts to take the medication, that they're aware of what they're getting at the end of the day.
Some patients, like we saw Patrick, get antidepressants. Does that end up being a lot to get off of? You're on antidepressants, you're on pain meds.
Also, as a psychologist, because I don't have the prescriptive authority, so I usually don't comment on the medication on my clients, but basically I help them to cope with the psychological part of that journey. Yeah.
Part of the reason antidepressants are prescribed, though, is that there's a lot of overlap in the brain chemistry between depression and pain. So the same molecules that help reduce depression or manage depression are also pain-killing molecules in your spinal cord. So sometimes we find that tricyclic antidepressants or other types of antidepressants are really effective at reducing pain. So it's not always just the opiates, right? Opiates are incredibly powerful painkillers, and they're great in the short term. But there are other measures that we can also use pharmacologically. One is cannabis that's getting more and more popular.
Yes, we should talk about cannabis, but right now we are going to take a break, and we'll talk about that when we come back.